For today's episode, we have an amazing guest with an incredible story of resilience and recovery. I heard her speak at our Harvard platform for lifestyle medicine and was fascinated by everything she spoke about. It's my pleasure to host Dr. Lisa Doggett today. Welcome, Dr. Lisa.
Thank you so much for having me.
Thank you for taking out time from your extremely busy schedule. Please tell us a little bit more about yourself, your career, your health, and anything that you'd like to share with us.
Sure. I'm a family and lifestyle medicine physician based in Austin, Texas. I'm also an author. I wrote a memoir about my journey as a physician turned patient with multiple sclerosis. It's called Up the Down Escalator: Medicine, Motherhood, and Multiple Sclerosis. And I really wanted an opportunity through that book to share my experience as I learned to cope with a chronic disease like MS, also an autoimmune disease, that had a huge impact on my life, and it continues to have a big impact on my life almost 16 and a half years later. So I'll share a little bit about my story. I was running a clinic for people without insurance and without private insurance back in 2009 and raising two little girls. My daughters were at the time 2 and 4 years old. And I woke up dizzy one morning. I thought I was just getting a cold. It was some sort of weird virus. And I started just kind of thinking, okay, I'm just going to get through my week. But the symptoms got worse. And by the end of the week, I was having new symptoms, including taste changes and some visual blurriness or kind of cloudy vision. I was able to seek out care very quickly. I saw a neurologist, then I saw an ear, nose, and throat doctor who ordered an MRI, and that MRI led to my diagnosis with MS. Within less than a week and a half, I was diagnosed with MS. So I was very fortunate because a lot of autoimmune conditions are hard to diagnose and take weeks, months, sometimes years before people get a diagnosis. MS is one of those conditions that tends to be hard to diagnose because it can present in such different ways. Every person's different. Anyway, it was a huge shock to receive this diagnosis. I was 36 years old, I had these two little girls, this really busy, stressful job, and I really was just like, my future is canceled. I don't know what else to do. I don't know how I'm going to be able to go on with all meeting my own personal goals, raising my kids, being a successful physician, being a physician at all. I didn't know if I'd be able to do any of those things. And I had quite a time coming to terms with my diagnosis, really started to kind of see myself differently. And I was also coping with significant symptoms. I had dizziness that continued for every day for a couple of years before I learned some strategies to handle it better. So I've now lived with MS for, again, almost 16 and a half years. It's been quite a journey, but I've learned a lot, and I now have just feel like I've gained a lot of strength and wisdom in the opportunities that have come from even having MS. I've connected with the National MS Society. I've got certified in lifestyle medicine. I've really made my own self-care a huge priority and really made sure that I don't get other chronic conditions besides MS. Other chronic conditions like diabetes and heart disease are more common in multiple sclerosis. So I want to avoid that. Yeah. So what else do you want to hear about?
Oh, you look great. I mean, it's wonderful, and it's interesting that you mentioned about the diagnosis because for my own autoimmune, it took them about a year to diagnose because they were,
Yeah.
they would say either it's this or that, and nothing was conclusive. So, it's in a way good thing that someone gets diagnosed quicker because then being in unknown is so difficult for, and not for just myself, but the family as well, because where symptoms of autoimmune
Right.
are so unpredictable. Um, I found this very fascinating that you would want to write a book because I've interviewed so many patients with autoimmune and most of them want to keep their journey private.
Yeah. Yeah. No, that's a good question. So let me first back up a little bit and just explain what multiple sclerosis is. Because that's part of the reason I wanted to write a book is that MS is not well understood. I think people are familiar with the name, but don't really know what it is. I, as a physician, wasn't very familiar with it. When I was having symptoms, it never occurred to me that I could have MS. But now looking back, I was like, oh, yeah, I should have thought of that. And I didn't. MS is a disease of the central nervous system, so that means the brain, the spine, and the optic nerve, and it causes a whole variety of symptoms that include often like mobility challenges, sensory changes, visual symptoms frequently, also things like cognitive problems, like with attention and focus. It can cause bowel and bladder problems, increases the risk of depression and anxiety, sleep problems, and pain. Those are all fairly common symptoms. The number one symptom is actually fatigue. And there's a lot of other things that can cause fatigue too, but MS tends to be associated with a significant risk of fatigue. So as I was kind of processing my own diagnosis with this kind of weird condition, which, by the way, there's nearly 1 million people in the US that have multiple sclerosis. So it's not that uncommon, but it is a strange disease that can cause all kinds of weird manifestations, and is treatable, not curable, but there are really effective treatments out there. So I do want people to know about it. As I was processing all this, I started writing about it more and more. I keep a journal. I've always kept a journal, but I started to document my symptoms, started to try to look for correlations between stress and my dizziness, sleep issues, as well as my mood. How did all of these things link together? And I don't know that there's like a great correlation with all of them. Certainly, if I'm stressed, I'm not going to sleep as well. That's going to lead to mood
Yes.
problems. I mean, there are certainly correlations to some extent, but not necessarily like really obvious correlations. But I think that it just helped me to start to process my symptoms, to process my living with this disease. And it was just one of the tools that helped me to come to terms with it. And then when I started thinking about writing a book, I had all my journals to draw on. And I really did realize I wanted to tell my own story, but I also wanted to tell the story of my patients that I was seeing at my clinic. They didn't, for the most part, did not have multiple sclerosis. I talk about one in the book who has MS, but they were coping with a whole variety of other challenges in addition to chronic conditions. They had acute illnesses and significant problems with housing and financial concerns and family worries that made it really hard for them to deal with their own health. So I wove that whole narrative of the clinic and my own story together, and just tried to kind of make sense of everything. And hopefully, I did that to some good effect with the book.
I'm sure you did. Do you have a book on hand that you can show me?
Ah, funny you should ask. I do. This is the book right here.
I will get it, and I will, because when you talked about it in that session, I was like, I'm going to definitely get it.
Great.
This is
There's an audio book too, by the way.
okay.
So that is
So
my preferred way to read books these days, is through audiobooks. And
okay.
I got to narrate it, so that was a lot of fun. But please, yeah, check out the book. It's on Amazon, and you can order it
Right.
from your bookstore. It's at some libraries too.
That's wonderful. You did mention that you felt that stress sometimes did affect your symptoms, but because my project is specifically about stress and autoimmune disorders, and the research that I did, literature review that I did, there is overwhelming evidence that stress does aggravate, not
Yeah.
maybe not
Yeah.
all, but certain autoimmune conditions. Um, do you have any personal experience? Like, can you tell me one symptom or something that you felt that because I had a stressful day or I have a stressful day ahead of me that I'm feeling this more?
Yeah. So I think two things come to mind. One is that if when you'll see this when you read the book, but my MS symptoms started after an incredibly stressful weekend. And I
Okay.
write about that weekend. I remember it so well. My daughter was turning 2. We were having a birthday party. It was Halloween. There were all these Halloween events we were doing. There was also a family brunch that I went to. I was hosting some people from work. I don't even know if I wrote about that in the book, but like I also was hosting people from work. There was a walk that we all went to do, like a group, like a charity walk. I mean, there was so much going on that weekend, and I was just, and I had my husband working at the hospital, so I didn't have his help with the kids, and I had, these 2 and 4 year old little girls to cart around with me. I was so exhausted, and then I woke up Monday morning dizzy. Um,
Well,
so, there's got to be something to that it happened after this incredibly stressful weekend, and which is already a stressful period in my life, but that was particularly just crazy busy time. The second thing that comes to mind with stress and MS is that was something that I discovered really unexpectedly, and that is that I learned that mindfulness-based stress reduction meditation
okay.
is a hugely important part of my ability to cope with my dizziness. I took a class, an MBSR class, about 10 years ago. And
Okay.
I also have a whole chapter about it in the book. But I wasn't expecting it to help my MS at all. I took it because I wanted to deal with stress. I knew that's an issue in my life in general. But what I found out was it really helped me with sleep. It helped me with anxiety. It helped me with stress. But it also helped a lot with dizziness. And I have since incorporated meditation into my everyday regular practice so that I start my morning with a short meditation. I end the day with a short meditation. I sleep better and I have less dizziness during the day. And I was like last week, I woke up, I was super rushed. I can't even remember what I was doing, but I had a lot to do. I missed my morning meditation and I ended up being dizzy most of the day. And I was like, oh gosh, wow, there really is something to this because I start to doubt it every now and then. I'm like, no, actually, I have to make sure I do that every day because it does make a difference.
Is this a guided meditation or something that you've devised for yourself?
Yeah, so MBSR is mindfulness-based stress reduction. It's a form of meditation that's really
Yeah.
focused on being present in the here and now without judgment, just sort of
Mm,
observing your thoughts and feelings and things around you and your body, your breathing most of the time. And it's a very well-known evidence-based technique for helping
okay.
with a whole variety of conditions, most notably pain and depression and anxiety. But many, many other things can be helped by it too.
Interesting.
And so I have used as when I took a class, there's an 8 week class that's offered all over the country. You can do it virtually. There are some in-person options in different cities as well. I went and took the class, which met once a week. I think it was an hour and a half for 8 weeks. And then we had a guided full day meditation at the end. But those sessions were a process of learning about different forms of meditation, practicing with a group, and then debriefing with the group and the teacher. And it really taught me like how to meditate because I thought, gosh, I can't do this. My mind's wandering all the time. But
Yes.
I learned how to really observe my thoughts and accept that and not be frustrated by it. And so I think that class was really foundational for me to really understand it. And so at this point, I don't usually do like I sometimes will use an app or something to do meditation. And I recommend that to a lot of patients who are getting started with it. But I just do my own kind of guided, I'll kind of do a body scan at bedtime, for example, and I'll do my own kind of self-guided meditation. But I don't
That's very
usually use an app.
helpful. I think that this is very helpful. MBSR, when I've discussed with patients, so you mentioned most of them are not, they don't know it. I've heard it from Dr. Freitas. She mentioned a couple of times. Um, Somehow the way it comes across is as if somebody would take it who's been through trauma. So,
Mhm.
it's like I don't think that the autoimmune patients identify with it. So that's one of the
Mm.
reasons that I wanted to have a website or a workshop because a lot of modalities are there, but autoimmune patients do not seem to identify that as if this is specifically for me. So I wanted to put something like, this is a website, and this is these resources specifically for autoimmune, so that people would, feel that. I just feel that people don't have that much awareness of their own, what would help
Right,
them. It's just they feel that, physical activity, how would this help me because this is a physical condition.
right,
When you
right.
when you discuss that, but like you said about meditation as well, that to see the results, you have to be consistent about it, right?
Yes,
Not
yeah,
see the results in one day. So this is a sort of an awareness campaign as well. And I'm hoping that, I will see the results that I desire. But I'm kind of, what can I say, like customizing it as the feedback comes as well. Um,
good. Yeah.
some, so for I really appreciate, this discussion, and I would just, like you to answer one last question that if someone
Sure.
is diagnosed with an autoimmune, like a newly diagnosed with autoimmune, or someone who's struggling to manage their symptoms, what would you advise? Like, what is the, let's say, first step?
I think the first step is to get a good doctor who you're comfortable with, who's got a good reputation, who is evidence-based in their approach. With my multiple sclerosis, I have fully embraced lifestyle medicine, but I don't do lifestyle medicine to the exclusion of other medicine. So I still take my disease-modifying therapy infusions every 6 months. Taking medication is essential for my health in addition to all of these important lifestyle habits that I use to help deal with my symptoms and also prevent other chronic conditions. So I think finding that doctor who's going to be your partner along the way is really important. If you can get a family member, a close friend to go with you to at least the first few appointments, so you've got some extra support. Take a
Okay.
list of questions. If you're not comfortable with your doctor, you don't end up trusting that person, then look for someone else. But it's really important to find someone who's knowledgeable and can really help guide you through that process as a teammate because you're in that together in that situation.
Oh, that's wonderful advice. I think that this truly is the first step because we cannot be experts. You would have to go to an expert to help you
Sure.
navigate. Yes. Thank you so much. I truly appreciate your time and talking to you. I think I can talk to you for hours. And I
Sure.
will yeah, but I'm truly grateful that you're part of my podcast, and it was wonderful talking to you. Thank you so much.
Sure. Thank you too. Take care. Good luck with your project.
Thank you.